it's Dr. Stephanie with Coherent Health, back with another episode of Must Know from My Modality to Yours, where we invite a health and wellness professional to talk about the top 1 to 3 things they think you should know for your clients. And today we have with us Jewel Cunningham, a somatic psychotherapist who helps people understand and work with their stress responses through somatics, archetypal exploration, astrology, and yoga. Her approach is deeply informed by the Tao of Trauma, which is based on Elaine Ducan's life work, and bridges Eastern and Western healing traditions to support the body's natural rhythms. Jewel also offers touch work for those interested in deepening nervous system regulation. Beyond her private practice, Jewel recently launched Therapy Lunchbox, great name, a platform that offers mentorship to mental health professionals, helping them develop their own clinical voice and build sustainable, values-driven practices. Additionally, this community creates space for discussions at the intersection of mental health startups, AI, and clinical work, bringing together therapists and innovators to explore the future of the profession. This all sounds amazing, Jewel, and I'd love to hear more about your approach and your work with somatic psychotherapy with your clients.
Great. And thank you so much for having me. It was so lovely meeting you both at the event that you hosted. And I could see how so many of our values and our vision for building community and helping people to connect to holistic care, I could really see that connection between us. So I'm very appreciative of being here.
Likewise.
Yeah. So as you said, I am a somatic psychotherapist, and I initially started in the cognitive processing, so the CBT realm. And what I noticed with clients is that while their PTSD was getting better, there was still the physiological aspect. And I remember a supervisor at the time told me, well, maybe this is just as good as it's going to get, and that's okay. They need to learn to accept that it might just not get any better. And I remember thinking that, like, that can't be it. That just doesn't seem right to me. To me, it seems like our body has this natural, intuitive wisdom to heal itself, and maybe something that applied during a traumatic situation or during childhood no longer matches the current environment. So that sent me on this journey of learning and exploring and trying to find other modalities to help clients on the aspects that the traditional Western mental health field wasn't addressing. And through that, I found a somatic experiencing and the Tao of Trauma by Elaine Duncan, as you mentioned, and just had such a healing and transformative experience with my own PTSD that I thought maybe the physiological aspect just won't ever change. But I've watched it change in myself, and have watched how that's allowed me to change with my clients too, and to do better work with them. And so I've become really, really passionate about learning about how my own system impacts the work that I'm doing. And one really cool story, which I'll share with you, my client gave me permission to share this, and he loves it when I share it. And he had what's called earth element disruption and trauma. So how that presents is ruminating and thinking about a problem over and over and over again, and all the potential problems, and making the same mistake and struggling to integrate lessons. And he didn't identify as having a trauma. He didn't remember any trauma from childhood, and now was using substance, or he's in recovery, but at the time was using substance to regulate himself. And so I spoke to Elaine, and she said, ask him about prenatal stuff. Was there any trauma prenatally, poisoning, colic, blood disorders, anything like that? And so 30 minutes after our session, I kid you not, he texts me and says, how did you know everything? My mom was exposed to radiation while she was pregnant. I came out and was very sick and colicky, ended up having a blood disorder and a bone marrow transplant all in the first 12 to 15 months of his life. And it was the first moment where he was like, this doesn't have to be so heavy. It's not my fault. And it's since been now a very long journey of how do we integrate this? How do we create whole system regulation? Because, with poison in the blood, it touches every organ. And so for him, it was like a global high, and regulating it through substance use. And so that was a turning moment for me, because I could feel it in the room. And I thought that maybe it was me, or maybe I wasn't doing a good job or not addressing his needs. And really, it actually turned out to be, I could feel into his system and it informed how I was approaching the work. And that created this beautiful collaboration where I started to learn how to let go of my own stuff in the room, how to identify where my psychology is and how that works with clients, and has led to, this program that I've created and mentorship that I've done, where I'm working with clinicians to learn about their own inner psychology and their own nervous system regulation, and then how do we use that to inform things clinically. So instead of when a client pushes, do we fall over or do we stay steady? And then they learn to come back to center. If we push a little bit, does the client fall over? How do we build more strength within that system and know where we can give, where we can push, where we can pull, and where we can kind of yield as well. So that's where I am right now in my work, where I'm helping clinicians and clients learn about their nervous systems and regulation and approaching it from a whole system perspective, because there's so many things that we don't know. And this client in traditional therapy would have continued to have this blame circle of, you're just selfish, you're using substance, it's selfish. And now he's had to have a bigger arc within his recovery of, this thing happened, it's affected my nervous system and how it's developed, it's going to be a challenge. And sometimes I do things that are selfish, but sometimes I can also do other things and make different choices. So that's where I am and the work that I'm doing.
That is amazing work. From my personal private practice standpoint, you know that I very much believe in an integrative approach, and you hit the nail on the head with both the client that you're working with, integrating all of the aspects of their being, as well as integrating different modalities into care, as well as integrating the experience of the client and practitioner. And that self and also co-awareness is so important because it's so missing in our current model, right? In our current model, there's the professional and then something entirely separate called the client, who comes in, who goes out, and it's as if we're not mutually affected or, as you said, collaborating, but we're in the dance together. So what can you share? Because this now touches all modalities and all practitioners. They're in a dance with their clients. What can you share from what you've gleaned about this sense of awareness and how it can be used to help the individual sitting in front of you?
Yeah, definitely. I mean, I think my work is informed by polyvagal theory. So just like this understanding of, the rise of the sympathetic system, higher energy, and then the decline or the fall into parasympathetic or collapse. So panic versus collapse are the extremes. And so when I'm in a room and a client walks in and they have really high energy, kind of like in that movie, The Proposal with Sandra Bullock, she walks into the office and everyone who had been chill for a moment is now frantic and like, oh my God, she's here. We can get carried away in that, right? So someone might pull us into the frenetic energy of, wow, there's a crisis. Like, I need to solve it. I need to fix it because that's what the client wants. This is a big problem. I need to solve it. But what does that lead to if the client can't integrate it? It leads to more crisis and more chaos, and then us being pulled out of our regulation. So it's about understanding what happens when someone who's really high activation comes into the room, and how does my nervous system pull closer to them. And maybe instead of allowing myself to merge with them, maybe I actually hold steady and have them merge more towards regulation with me in my regulated state. And on the flip side, a client might come in completely collapsed and just really slow and why bother? And how that leads to feeling tired for many clinicians, or helpless, or I offer a suggestion, the client says, no, I've tried that, nothing will work. And even those two examples that I gave, as the viewer right now, like, how did that feel to have me high energy and then also slow energy? So when we're in those different states, we can learn more about ourselves, and how we get out of them will teach our clients how to get out of them. And everyone's different, right? So someone who's collapsed, one person might respond to like a little bit of movement and psychoeducation to bring more energy into the room, whereas another one might respond better to problem solving. So it's about collaborating with your client, but also knowing, where's my nervous system? Right now it feels helpless. Okay, is this mine or is this my client's? And this isn't a blame game. This isn't like there's something wrong with my client. It's just, how do I understand myself in relationship to the client, because we're building a field together. And how do we acknowledge that together and work with it? And I've even mentioned to clients who are dissociating, like, I'm noticing the room's getting really heavy right now and I'm feeling like I'm sinking into my chair. What are you noticing on your side? And they'll often say, yeah, I'm feeling the same thing. Like, do we want to be in a relationship like this right now where we're both kind of not here? What would it be like to come back 5% more? And so for me, I have, grounding tools for myself. I might have an object. Often have water, because water is really helpful for me in terms of like, okay, this isn't mine. Allow it to move through my body, feel the water going through my body and out through my feet. But everyone's kind of different, in finding the tools that work for you in relationship to the different nervous system states, the high activation, the low activation, maybe even the spiritual, like joyful, like, oh my gosh, everything's so good. And because that's also really easy to get carried away into as well, and to bypass, the big event that had happened that week until 1 minute before the session ends. But yeah.
Yeah, I imagine of all the things, you may be seeing more frenetic energy these days with everything that's going on. From your personal professional experience, and I understand the answer might not be as simple as the question, but how have you been able to come to a state of self-observation so that you can notice what's going on with yourself in relationship to the client?
I would say it started with my somatic experiencing training, because they really encourage not giving a session while practicing with other clinicians. They encourage asking questions. And so I would ask in the moment, is this mine or is this yours? Or while I'm touching you here in this position, for some reason, an image of a horse galloping around popped up. And for me, that was at the time unfamiliar. And they're like, oh, I had an image of a horse in my grandma. So sometimes, asking can help you learn the difference between mine and yours. I don't think that that's necessarily appropriate to learn that with clients. That's something to practice with friends, to practice with family, and people that you trust, to be honest. Because if someone has like a tight stomach and a knot in their stomach, and you feel it and you say, was this mine or yours? And they say, definitely not mine. Then it can make it challenging, because now you have to determine, okay, is this really mine, or is this theirs? So if you have trusting professionals that you can practice this work with, it can be really helpful into learning to differentiate between systems.
That reminds me of walking into an airport. That might be a great place to practice, right? You walk into the airport and there's a lot going on. And I think, I have not studied this, I don't know that anyone has, but I think that a lot of the anxiety becomes collective there. And so that anxiety that's perceived at the individual level might actually be coming from the shared experience. I
think that's a really great example. Like airports, I have to put soundproof headphones over my ears to give me an extra layer of buffer. But I can totally relate to that.
Airports and maybe Times Square. And I know that you also do, in addition to your private practice, so much great work helping practitioners care for themselves, right? And taking care of the caretaker is so important and many times very neglected. Do you have any tips for how practitioners can take care of themselves, which will of course then help with their ability to maintain self-awareness and then act on it?
Yeah, I would say find what works for you. And everyone's going to be a little bit different. And so trying different tools and seeing how they work and how they create space within yourself and space within a relationship if needed. So someone who's high activation, maybe that energy needs to go into something more useful if it's fight or flight, right? So someone more on the panicky or really anxious, how can we use that life energy for something that's more productive versus is there something wrong? So for that person, it might be scanning around and looking your room and, okay, what are things that I want to change? And then actually changing them. So instead of noticing oh, I have this beanie sitting on my desk, I'm just going to leave it there. It might be, I don't like that it's there. I'm going to put it away. Also, finding ways to breathe and to release the diaphragms, because when we're really tight, we have our main diaphragm, but then, each joint system is also a diaphragm. So I like to do this one. This is Raja Selvam taught this in his training, where you release the peripheral diaphragms first. So 30 seconds on the wrist, 30 seconds on the elbow, 30 on the shoulder, and then the other way around too. So I'll do this between sessions, because think of it like if I were to get in a car accident and my arms are like this and stiff, the energy is going to go straight through the diaphragms and into the body and do a lot of damage, versus if I absorb it with all of my joint systems, there's going to be less damage. So the more open the joints are, the more the parasympathetic system can get online and to down-regulate when we're really tense. And then you can do like hip, knee, and ankle on both sides as well. For someone who tends to be more on the low energy side, gentle movements, because sometimes the low energy is called dorsal. Sometimes that state is so profound that any movement in energy slams the brakes again. So for those systems, we want to do gentle movement. So like stretching, and even saying something to myself of like, oh, okay, I have a little bit of life energy. I have a little bit of gas in the tank. I'm going to work on building that reserve up. But it's like more of like the small movements. So like a furling and unfurling can be really helpful because it's not too big of a demand. So that could be like, I want to be in a cave and hide, versus I feel really confident right now. We don't need to embody either of those states fully, but we can do just a little bit between the two so we can find a middle ground. And that's more of long-term work, because getting out of a dorsal state it does take much more time. But if it's small dorsal states between clients, small movement, going and washing your hands and saying, okay, I'm letting go of all this extra energy into the water, splashing the face can also be really helpful too. One of my favorites, I have these eye masks. I have two actually. Eye masks that I have my clients get that you freeze you throw them in the freezer. And so they can calm a very high sympathetic system pretty quickly because of the diver's response. And then my other favorite one, and clients love this, is do I have one on me actually? These old school rubber water bottles that you fill with water, and then you put them over your kidneys. And I'll have clients who actually do this while they're in session with me, because then the kidney relaxes away from the diaphragm. So there's more space for the adrenals and for the kidney system, less stress hormones being forced into the system. And it's really, really great. So you don't want to do electric heat, natural heat from waters. Oops, much better.
This is all great. I have an eye mask that I use, not frozen, but an eye mask I use with the clients I see. And some percentage of them, small eye mask, think it's a neck pillow, which is always very interesting to me, and proceed to lie down with this small little eye mask under their necks. Yeah, just a brief story. It always enjoy it when it happens. I also enjoy that you are bringing in, physical aspects, whether it's an eye mask or it's the body, to help shift a state of mind. Yeah. And of course, that's very much part of your integrative approach and working with people, not as if they are brains in jars, but a holistic mind, body, emotion, soul, spirit, etc.
Definitely. I feel like I think Western medicine is very great with diagnostics and identifying symptoms and treating symptoms. And there's definitely so much value in that. I'm by no means saying we shouldn't do Western medicine. I find it very valuable. But I also think that there's a holistic side that hasn't been studied yet. At one point, meditation and yoga were considered taboo and not evidence-based. And now we have more research showing that it actually does change the brain and the nervous system. And so I think having an open mind towards what works for different people and finding what works for you, and finding the communities that can lead you in that direction, because it still blows my mind the fact that you can't Google therapist meetup events in New York City and find something. And similar for holistic practitioners, Googling, before you guys came along, Googling like a listserv of how do I find different providers and compare them and what will work best for me. Before, you'd have to find a support group and hope that someone in that support group, if you could find it, knew of someone who you can by word of mouth find that practitioner. So I really love what you guys are doing in the community and addressing this need, because it's so important. And I have a feeling this is going to be the next wave of healing within Western culture, is going outside of just the symptom sickness model and finding other ways to treat and heal.
I agree, and I think it already is, that we are perhaps being forced into it, but appreciating that there are different perspectives on the body and hence different approaches to its care. And there's not one way that is the right and only way for every single person on this planet.
Yeah.
And not only do different modalities serve a purpose, but they'll serve a purpose at different times in your life. And as individuals are taking increasing responsibility for their health and wellness, I do see them on their own seeking out, different practitioners, different modalities. And I very strongly believe in collaboration and working together and strength and unity. And that is how ultimately all of us, me, you, all of us from all of our different corners of the world will be able to help shift the health paradigm together.
Agreed.
So thank you for sharing your health paradigm with us. Thank you for teaching our fellow peer practitioners about the importance of self-awareness when working with the client and the collaboration seen, unseen that occurs between. And you gave so many great tips about how to care for yourself so you can, support the state of self-awareness. Thank you. Was such a pleasure meeting with you. Is such a pleasure talking with you. And thanks for participating in Must Know from my modality to yours.
I love that. Must know. You gotta throw some spirit fingers in there as well.
Fingers. Yeah. These are spirit fingers.